Here with Dr. Kevin Ray, the Chief Physician at Physician Footcare. Talk to us and tell us about the practice, if you will.
All right. So Physician Footcare was started here in Orangeburg, South Carolina in 2006 with myself as the only physician and surgeon here at the practice. And 16 years later, we currently have somewhere about 13 to 14 locations here in South Carolina. We also have locations in Georgia and New York. So we've grown significantly. We have over 30 doctors or 30 providers that work for the practice. So we're the largest provider of foot and ankle care to all residents here in South Carolina.
Why is this so important?
Oh, wow. It's very important. Foot and ankle care is extremely important, especially in our rural communities. One of the things that we have done here at Physicians Footcare is really focus on the rural communities because, as we all know, rural communities are poorly served by the medical community as a whole. Those communities are also heavily populated with minorities, Black specifically. And the disease state that we most encounter, diabetes, and I say that 3 times because it's very, very important, is woefully undertreated by the medical professionals. And foot and ankle physicians are the most qualified to make certain that we keep you walking, we keep you with your feet, your legs, we keep you alive.
Do we meet people at the end stage in this area of disease?
Absolutely. Oftentimes, we would love to get you treated early. Right? Most people understand you got to go get a yearly physical. You got to go get a yearly eye exam. But most people don't understand that you should also get a yearly foot exam. And if we can educate our community to get a yearly foot exam, it would prevent or help us detect a lot of conditions much sooner so that people can keep their limbs.
Hello, my name is Dr. Muhammad Ansari. I am a physician here at Physicians Footcare at the Orangeburg office. One of our major goals here is to create and impact the population of diabetes. Here we provide care for diabetic foot care. We provide limb salvage foot care, and we also provide care for the elderly. Here our goal is to really reduce the possibilities of amputations for our patients. We know that patients in rural areas such as Orangeburg and patients who are or have much higher rates of diabetes, and with that, patients in rural areas also have a 35% chance of increase of having a leg amputation with that. And my goal is to impact and to reduce that risk of patients having amputations.
Do people know how dangerous they are, or when do they come to you? At the end stage, or is it caught on time in most instances?
In most instances, it is usually caught on time. However, there are many instances that we have where it is at the very end stage where we have to provide very aggressive wound care and also perform very aggressive surgery in order to really reduce the risk of amputation or provide the best amputation possible to ensure that patient is still able to walk. We also understand that patients who have amputations have a much higher increase rate of mortality and morbidity. Oftentimes, patients with at least a below-knee amputation typically have a 3 to 5 year lifespan due to the stress it causes on the body. So it's very important for us to make sure that we're able to preserve the limbs for these patients who are at risk with diabetes and who are living in these rural populations.
Talk to us about peripheral arterial disease, if you will.
Well, peripheral arterial disease is a disease where there is a blockage of the arteries going to the lower extremity. And with that tends to create something called ischemia, which is a decrease of blood perfusion to the lower extremity muscles and tissues. And what happens with that is oftentimes these patients present with what's called claudication, or pain at rest, or with pain with movement, or they also really feel their limbs becoming cold. And so it's very important that with these patients, their limbs are at risk of essentially dying due to the low oxygen and low arterial perfusion.
So basically, there's no blood flow going to their limbs?
Correct. With these patients, you typically have a decrease in blood flow going to the toes, and that's because your toes are furthest away from the heart. They are typically the last organ or last part of the body that receives the blood flow. And so these patients with peripheral arterial disease tends to have, really cold toes, and then
Can exercise help that? If they exercise as they're living their life in their 40s and 50s and 60s, would you prescribe a regular regimen of exercise or foot massage, or is there something that can help overcome this from happening in late stage of life?
Well, definitely exercise can help if it is not at an end stage. If you catch it early enough, exercise can be a great benefit for these patients, mainly due to increasing the circulation throughout the body with exercise. However, if the patient has late stage arterial disease, we do not recommend exercise until further surgical intervention has been performed.
Please tell us about people that smoke and how that might affect arterial disease.
So smoking is a very great risk for peripheral arterial disease and coronary artery disease as well. But oftentimes with peripheral arterial disease and individuals who smoke, smoking really causes a calcification of your arteries and really reduces the area which the blood has to circulate through the vessels. So, most smokers have a much greater chance, I don't remember the exact number, but a much greater chance of developing peripheral arterial disease because, again, smoking really causes that blockage of the arteries.
So, and it also limits the amount of oxygen.
Yep, having the blockage of the arteries really reduce the perfusion of oxygen to the tissues, and therefore the tissues begin to die out. So it's very important when you see patients with gangrene or dark toes and really cold feet. More than likely, there's a vascular issue, and if you smoke, you're at least greater than a 30%, 40% chance of developing this as well. And thank you all so much for having us. It's been a pleasure being able to provide the information that we provided today. You can find me here at Physicians Footcare, 718 Broughton Street in Orangeburg, South Carolina. I would love to see you all, and feel free to come in, make an appointment with us, and we'll take care of you.